Hello and welcome. This is Lita Downs from the Center for Faculty Excellence here at Walden University, and today I am here to moderate the paper presentation, Mental Health Outcomes Among Nurses During the COVID-19 Pandemic. On the line, we have Dr. Deborah Sullivan along with her daughter, Virginia Sullivan. Before I hand things over to them, I am going to go over a few housekeeping items in Zoom, and then I will hand things over to them. As most of you know, on the line we have many functionalities in Zoom. Just a quick recap, we have the audio settings in the lower left-hand corner. If you need to increase volume or toggle back and forth between your computer audio and your telephone, you can do so by clicking there. We do have a chat box, so please take a moment to enter any comments or questions that you may have throughout today's session in the chat box, as it will be monitored. Also, when typing in the chat box, please select all panelists and attendees. That way, everyone can benefit from the questions that you've placed or comments that you've placed in the chat box. We do have closed captioning as well for today's session. Finally, there's a view options dial up in the upper part of your screen. If you need to toggle out of the full screen view, you can do so, or even better, if you want to zoom in, you can do so by adjusting your zoom ratio. So as I mentioned, we have a fabulous mother-daughter team on the line today. We have Dr. Deborah Sullivan. Dr. Sullivan is a senior core faculty member here at Walden in our College of Nursing. We have Virginia Sullivan, who is a research assistant at the New School for Social Research. Also a contributor, investigator to this project is Dr. Deborah Witherspoon, who is a senior core faculty member here at the College of Nursing at Walden University. At this point, I am going to turn things over to our presenters. Welcome, Dr. Sullivan.
Thank you, Lita. And welcome, everyone, and thank you for joining us today. As you all know, as everyone in the world knows, that in March 2020, the World Health Organization declared a pandemic caused by the novel coronavirus, also known as COVID-19. The virus spreads easily by droplets and aerosol. Healthcare providers were required to work on the front lines by the influx of coronavirus-infected people in hospitals and the rapidly changing severity of the situation as their numbers increased. Nurses are the largest healthcare profession, and they were asked to provide care to these large numbers of infected patients. These nurses working on the front lines during COVID-19 pandemic are vulnerable to negative mental health outcomes. Some of the occupational risks that we can think about are that nurses are at risk due to working directly with infected patients and working longer shifts. Many are working mandatory overtime due to high numbers of very, very sick patients. They are witnessing patients and even their coworkers who are dying from COVID. They have limited personal protective equipment. They're having to reuse masks and gowns. I've had students report to me that they had one gown per patient and that they had to put it on as someone else left the room. They had to put on that same gown. And they're reusing their masks, sometimes for a week at a time. So early on, there were large studies from China and Italy that showed evidence that nurses are experiencing negative mental health outcomes, such as psychological distress, anxiety, depression, and suicide. So as nurses who are also students, the risk for high stress levels would seem even higher than their cohorts that they're working with. As nursing faculty, I had students who were behind in their assignments because of having to work overtime. They were sick because of contracting the virus. I was fielding calls and emails from students who were begging for more time to complete their assignments. In general, their grades were not as good as in previous classes. Next slide. In March and April, when we looked into this problem, we found few articles written about the mental health outcomes of healthcare workers in China. But there were no quantitative articles or studies being done that we knew of in the United States. And there continues to be a paucity of evidence related to the mental health outcomes of nurses or nursing students. There are a few qualitative articles out there now, though. The following two articles we found were of special interest. The Lai et al. Article was a cross-sectional survey, and we used this study as a model for our study, although we used some different tools. And in this study, they had 1,257 healthcare workers from 34 hospitals in China. They were frontline healthcare workers engaged in direct diagnosis, treatment, and care of patients with COVID. And they were associated with a higher risk of symptoms of depression, anxiety, insomnia, and distress. Another article we found was a systematic review by Pappas et al. That looked at 12 studies from 33,062 participants in China. 23.2% were found to have anxiety, 22.8% with depression, 38.9% with insomnia, and in general, nurses were exhibiting higher rates of affective symptoms. Next slide. So due to these high numbers, we felt that it was a good idea to do research on this population. So the aims of our study are to determine if the COVID-19 pandemic is having an impact on the mental health of nurses, and nurses who are also students. Working in hospitals at this time, specifically the mental health measures of depression, anxiety, trauma, and burnout, as measured by the stated scales that we'll go into later. A secondary aim of the study is also to identify whether the mental health of nurses working on the front lines during COVID pandemic have significantly more impaired mental health than nurses who are not working on the front lines. Next slide. We applied for IRB through Walden University on April 27th. And our study is a snapshot look at nurses during COVID-19 crisis with literature controls used as control groups. So our study is a cross-sectional study that used an anonymous online survey and again used literature controls for comparison. The data analyzed in this presentation only represents the data that we collected for about a month from June 8th through July 13th. And next slide, please. And just to go over the recruitment and sample, the survey was placed on the Walden University participant pool on June 8th, 2020. The participants could be faculty or students. However, it was mostly students who did participate and completed the survey. The data from the participant pool was downloaded on July 15th. And we had asked for a change in our procedure through the IRB and received that. And at that time, we opened it up to all nurses. We posted the survey at that time on July 13th. We posted it to several professional nursing organizations. And in August, we were able to download all the nurse email addresses from Florida, New Hampshire, Nevada, Rhode Island, DC, and Vermont. And so we set up an email domain and server and actually sent out 500,000 emails. However, we did get a low response rate, and now we have about 1,100 surveys to look at, which seems like a small amount considering all the emails, but you know, they go to spam and things like that. So we're happy that we have that large number of respondents. Next slide. Our survey, on the survey, we asked for demographics. We asked questions about personal protective equipment, staffing, overtime, and then we had a comments question. We used the tools, general anxiety disorder. And secondly, we used the patient health questionnaire, which measures depression. We also included the impact on event scale, which is a 22-item scale. The Oldenburg burnout inventory, which is 16 items. However, in these preliminary results, we did not analyze the results of that tool. And we also had a comments question. At the end of the survey, we also provided a link to a free teletherapy service, just in case there were anyone that wanted more help. Next slide. And just real quickly, the generalized anxiety disorder, or better known as the GAD-7, has 7 items, and you can see the scoring 0 to 4 is minimal anxiety, 5 to 9 is mild anxiety, 10 to 14 is moderate anxiety, and 15 to 21 is severe anxiety. Next slide. The patient health questionnaire, also known as the PHQ-9, has 9 items, and the scoring is 1 to 4 for minimal depression, and it goes up to 20 to 27 for severe depression. Next slide. The impact of event scales looks at PTSD, and it has 22 items, and it measures how the COVID-19 event has impacted the participants. And on this tool, there's if you scored 24 or more, PTSD is a clinical problem. And 37 or more, this is high enough to suppress your immune system functioning, even 10 years after an impact of the event. Next slide. And now I'd like to turn it over to my daughter, Virginia Sullivan. She's going to go over the results of the preliminary data.
Thanks, Mom. And you can click to the next slide. So we collected a total of 255 surveys from the Walden nurses on the participant pool. And of these, 42 were omitted due to incomplete or partial responses. And of the remaining 213, we decided to narrow our sample size based on a question that we asked, asking whether or not participants were frontline workers during the pandemic or not. And there were 5 possible responses to this question, depending on if they were currently working on the front lines, if they had in the past, or if they had never worked on the front lines. And just because these are some preliminary findings, we decided to narrow this down to current frontline workers and people who had never worked on the front lines. So after this, we had a total sample size of 136, and 73 of these were frontline workers and 63 were not frontline workers. And this data set was pulled on July 13th. However, we are currently still accepting responses from nurses all over the country. We have over 1,000 responses, and I'll present on a few preliminary findings from that as well. And you can go to the next slide. So for our demographics, we found that 42.6% of our sample were aged 35 to 44, followed by ages 45 to 54, 27%, 25 to 34, 21%. And the vast majority of our sample, about 95%, were female, and the remaining 5% were male. Next slide. And we also asked questions about education. And so the majority of our sample, 69%, held a bachelor's degree. 19% held a master's, 10% held an associate's, and 2% had a doctorate. And nearly 90% of our sample consisted of students, with just over 10% stating that they were not students. Next slide. And so 68% of our sample indicated that they were married, 20.6% indicated they were divorced, about 10% had never been married, and 1.5% were separated. We also asked them to classify their place of residence. 58.8% indicated that they lived in a suburban area, followed by 26.5% indicating they lived in a rural area, and 14.7% indicating that they lived in an urban area. Next slide. We also asked our participants to indicate their specific state and country of residence. And as you can see, we actually got a pretty equal distribution of respondents in the US, with most of them residing in Florida and Texas. We also had 1 participant who lived in Canada and 1 from Zimbabwe. Next slide. And lastly, we asked about the organization that they worked for. Most of our sample, 64%, worked in hospitals, 22% indicated other, and 13.2% indicated that they worked in a clinic. And if they responded that they worked in a hospital, we also asked them a follow-up question if this was a VA hospital, to which 6 of our participants indicated that they worked in a VA hospital. Next slide. So as Dr. Sullivan explained earlier, participants filled out the PHQ-9, which measures depression, the GAD-7, measuring anxiety, and the IES-R, which measures trauma related to an event. The results of these scales were analyzed in 3 ways to address the aims of our study. So first, we compared frontline workers in the sample to the non-frontline workers to determine if working on the front lines of the pandemic had an effect on mental health versus being a nurse not working on the front lines. Secondly, we compared the results of the total Walden sample to population controls pre-pandemic to examine the mental health of Walden nurses during the pandemic when compared to pre-pandemic norms. We also compared the measures for depression and anxiety to a large sample of university students from across the country pre-pandemic. And then, as I said, we did some preliminary results on the larger sample. So first I'll present on the results from the PHQ. And we found that 44% of our sample scored in the range of having no depression. However, there was a mean score for the total sample of 6.68, which is in the range for mild depression. We also had 16 participants with moderate depression, 13 with moderately severe, and 3 showing signs of severe depression. Next slide. Those that indicated they were working on the front lines of the pandemic also largely showed no signs of depression. However, again, we see that there is a mean of 6.77, scoring in the range for mild depression. And we can also see that our 3 participants who scored in the severe range all appear to be frontline workers. Next slide. And we see surprisingly similar results for our non-frontline workers. 46% showed signs of no depression, and there was a mean of 6.59. Next slide. So when we compare the results of our frontline workers to our non-frontline workers, we see that they are not significant, and they're experiencing similar levels of depression in both frontline and non-frontline workers. Next slide. However, when we compare the results from the Walden nursing sample to the general population norms pre-pandemic, we do find significance, with our Walden nurses experiencing higher levels of depression. Next slide. And so, as I said, we also compared the Walden sample to a large sample of university students from across the country. And to our surprise, we found significance in the opposite direction of what we expected, with university students pre-pandemic showing significantly more depressive symptoms than our sample of Walden nurses during the pandemic. Next slide. So moving on to the GAD-7, which measures anxiety, we saw largely similar results to the PHQ. 52% scored in the no anxiety range for the total sample, with a mean score of 6.32, again in the mild range. We did see 13 or 10% of participants score in the range for severe anxiety. Next slide. For our frontline workers, just over half, 51%, showed no signs of anxiety, with a mean of 6.33 and 8 or 11% scoring in the severe range. Next slide. For non-frontline workers, the scores were not much different, with 54% showing no signs of anxiety, a mean of 6.32 and 5 in the severe range. Next slide. And again, when we compare our frontline workers to non-frontline workers, we did not find significance, and in fact, their scores were incredibly close. Next slide. We did, again, find significance when we compared the Walden scores to the pre-pandemic general population control scores. As you can see, the mean anxiety is significantly lower, not drastically lower, but enough to move from no anxiety to the mild anxiety range. Next slide. And when we compared these to the student university large sample, we did not find significance here. So Walden nurses and nursing students do not appear to be experiencing more anxiety during the COVID-19 pandemic than university students on a regular basis. Next slide. So next we wanted to look at trauma and the impact of being a nurse during COVID-19. And this table is a little bit more confusing just because of the way the scoring works for the IES. So a score below 24 means the participant is not showing any signs of anxiety or of PTSD due to the coronavirus outbreak. And if they score above a 24, PTSD should be a clinical concern. If they score over a 33, this person will likely receive a diagnosis of PTSD. And if they score above a 36, this person is likely experiencing immune system suppression due to severe PTSD. We wanted to see how many participants were in each range. So we broke the scoring up into those who scored below 24 for no PTSD, those who scored above 24, those who scored between 24 and 32, those who scored over 33, and those who scored between 33 and 36, and also those who scored over 36. Unfortunately, I made an error when uploading these slides, and I forgot to include the immune suppression row for scores above 36 in each of these tables. I apologize for that, but I'll let you know how many scored in that range on each slide. So for this, we found that 65% of the total sample showed no signs of PTSD, and there was a mean of 19.3, which is below the cutoff for PTSD concern. And in the total sample, there were 22 participants in the immune suppression range. Next slide. For frontline workers, 70% showed no signs of PTSD with a mean similar to that of the total sample, 19.41, and 13 or 18% of the frontline workers were in the immune suppression range. Next slide. Non-frontline workers were again similar to frontline workers with a mean of 19.17 and 60% showing no signs of PTSD. And for non-frontline workers, they were 9 or 14% in the immune suppression range. Next slide. And as you might have guessed, we saw very similar means for the frontline and non-frontline workers and did not find significance between these two groups of Walden nurses. Next slide. However, when we compared the general pre-pandemic population mean of 14.4 on the IES, we again did find that Walden nurses were experiencing significantly higher trauma symptoms. Next slide. So we also wanted to present, as I mentioned, a couple of preliminary findings from our larger nursing sample. And this data was pulled on September 13th, at which point we had an N of 630 after excluding incomplete or partial results. So we compared the Walden nursing sample on the 3 scales measuring mental health and did not find any significant differences between the 2 samples. Next slide. We also did some preliminary analyses of the frontline and non-frontline workers in the larger sample. And we found that in this sample, frontline workers are experiencing significantly more anxiety and PTSD than non-frontline workers. Although this finding was not found to be significant for the PHQ measuring depression. Next slide. And then lastly, as my mom mentioned, we asked a comments question or a qualitative type question on the survey that asked participants to share, if they wished, what their experiences of the pandemic have been like and if they are using any coping methods. So we wanted to share just a few of the responses from the Walden nurses that we got to this question. We didn't have time to do any sort of analyses on these results, but we just picked out a few that stood out to us, and I will read these. This 45 to 55-year-old female from North Carolina shared, "Episodes of exposure have left me scared of dying on a ventilator. I have pulled out my will and made my husband promise not to let this happen. I have also made my wishes clear to my coworkers. I am saddened that the patients didn't get to spend the time they had left with their loved ones. Instead, we are putting 70-year-olds on ECMO where they often end up dying with just me holding by their side, holding their hand. I care, but it does not take the place of having their loved ones there. We have to get the PPE and staff to allow families to be with their loved ones, even if for a short time. Families need to see what their loved ones are experiencing. I finished my BSN during this, and at the time, I didn't realize how it actually helped me to be forced to think about something more than work. I do feel it is becoming more of a new normal for our unit, and I can't say I love it. I have frequent headaches from the masks and often sweat through my scrubs from the gear." Next slide. This 35 to 44-year-old female from North Carolina remarked on how the pandemic has affected her schoolwork. She shared, "Last quarter, it was necessary for me to drop one of my classes due to not being able to retain the information I was reading. I was unable to turn off my mind to COVID-19 and concentrate on my schoolwork." And this 55 to 64-year-old female student from Georgia also shared how her classes have been affected. She said, "With the initial pandemic, I became anxious and physically ill, requiring a 1.5-week sick leave from work. COVID-19 impacted my ability to think clearly or focus without thinking about how to protect myself and my family with limited PPE and reusing contaminated PPE. School became more challenging than normal, and I was unable to focus on the course. Currently, I feel a little more comfortable at the hospital since we are seeing more non-COVID patients. The anxiety still rises when I know that I must admit a COVID patient. I believe I have sustained some PTSD from the pandemic." Next slide. An 18 to 24-year-old female from New Jersey shares with us, "I frequently have vivid flashbacks thinking about my patients who quickly went down the drain, needed to be intubated, and then later died. I often think what I could have done better to save them and if I did something wrong." And this 35 to 44-year-old female from Connecticut shares her experience. "I have found the COVID pandemic to be exhausting and stressful on many levels. Initially, the influx of patients was frightening. I was terrified of catching it and passing it to my husband, my children, and my parents. After working in the intensive care unit, I am haunted by the images of countless patients being ventilated prone. I ended up catching COVID and had to go through 2 weeks of isolation. I used to love my job in the hospital, but now I dread going in. The numbers here have improved vastly, and I am finding some time to recover. However, in the back of my mind, I am so scared of the next wave that may occur." Next slide. And now I'll hand it back over to you, Mom, to discuss some of our conclusions and future plans for this work.
In conclusion, to summarize the results comparing Walden nurses to the general population, our larger sample of nurses, and to a literature control of students prior to COVID-19. Walden nurses during COVID-19 had significantly poor mental health outcomes on all 3 measured dimensions in the general population before COVID. We expected this based on the comments we were getting. Walden nurses did not have a significant difference in mental health outcomes in the larger sample of nurses. This was a little surprising because we expected our students, based on all the comments I was getting, to have higher stress levels than nurses who did not in school. When Walden nurses during COVID-19 had lower scores of depression than students before COVID-19. When considering this statistic, we must also consider that students in the literature control were younger and not working. Our nursing students are usually older. Our sample showed a median age of 35 to 44, and they all had work-life experience. Walden nurses during the COVID-19 pandemic did not have significantly different scores on anxiety than students before COVID-19. This was also surprising. We expected higher scores on anxiety for our students working during COVID-19, but it may go back to the reason that our students are older with work-life experience. Next slide. We also found for Walden nurses, there was no significant differences between nurses working on front lines and nurses not working on front lines. In our larger sample of nurses, the frontline workers had significantly higher depression and anxiety, but there were no differences for the PTSD. Next slide. So for future work, we'll be running some more correlation statistics to answer some more questions, such as, is there a significant correlation between nurses who had a shortage of staff working overtime, personal protective equipment, or working overtime with increased anxiety, and we'll compare that to the increased anxiety, depression, PTSD, or burnout. We'll do a more in-depth analysis for controlling variables such as age. We'll also do an analysis on the Oldenburg burnout inventory, and we'll look a lot more closely at the qualitative responses that we received. Next slide. And here's a list of our references. And I think that those can be given to you if you would like a copy. And that's all we have. And we're open to questions.
Thank you.
Thank you very much.
Thank you. And if you have any questions or comments, please enter them in the chat. And when doing so, please select all panelists and attendees so everyone can benefit from your comments. I think you addressed the topic in such thorough detail, which was very informative, and I enjoyed reading over the data. I had a peek into your slides, of course, because you sent them to me prior, and just really, really interesting findings.
We were very surprised that we didn't see a big difference. We seriously expected the nursing students to have, the high anxiety, high depression, but we didn't see that. I mean, any more than other nurses. And I guess nurses take it in stride. They're trained to, to be okay during high stressful situations. So that was surprising. I mean, especially with the two studies that we found early on.
Most definitely. Well, I want to thank you both for presenting this and enlightening us with all this information. Dr. Witherspoon as well for joining in the audience. Suzanne Kramer had placed in the comments to all panelists, thank you both for your presentation, very interesting. I work part-time for a home health care agency here in Minnesota. And speaking for our nurses, they are rock stars, and I cannot agree more. If it wasn't for our nurses, we'd be in a world of hurt. So thank you for being on the front lines. Wonderful. Well, this presentation will be placed into ScholarWorks at the beginning of November, I believe November 1st to be exact. So if you would like to re-listen to any part of today's presentation, you can do so by visiting ScholarWorks found through our Walden website. Please check your app for upcoming sessions. I believe we have an hour break right now, and we will resume in an hour. So do check the app and find another session. It's plenary sessions, actually, that will be occurring next round, which, let me see here, we have Dr. Richard Balkin and Dr. Montrese McNeil Ransom. So two great sessions to choose from. Thank you again to our presenters. We hope we have a wonderful weekend, and we will see you in research. Take care.
Thank you.
Thank you.